So, Amaya, you're doing something that's very ambitious. You are taking on the goal of becoming a doctor and also being a public health practitioner. Why do you want to do both? And what motivated you to want to do both sides?
So, why I wanted to do both is because through my work as a student health ambassador, I realized the implications of how important public health and social determinants of health are to our community and globally as a community. And I just knew that wanting to help children meant not just helping that child, it means their family, it means their school, it means their lived experience. And you have to be able to help the whole child. You can't just help one. And one of the main reasons that brought me towards this was I traveled a lot as a kid. I moved a lot, and I knew that in different aspects of the world and communities that we live in, there are various different things that can trouble communities and families. And there isn't just one specific thing to target, there's multiple. So, taking that multiple approach versus just a single target is something I want to do versus just seeing patients in and out.
Okay. So, if I had to reinterpret that, that means that when you're a physician and someone comes to see you, a child, in the up close part, you want to be able to work on whatever that child came in with and whatever's affecting them, like kind of like in the foreground.
Yes.
But you're also interested in what happens in the background, meaning what was happening in their home, what was happening in their neighborhood, what was happening in their state, their city, their country that may have allowed them to develop that condition. And you feel like you need to have a wrap or a thought process around both to be effective in what you're doing. Would that be correct?
Yes, exactly. For example, if a child comes in with issues like asthma, and we can just give them an inhaler, but to take it a step further, maybe that home needs an air purifier. Maybe we need to look at the route that the child's taking to school to see if they're able to get fresh air. Maybe there needs to be a park or community center nearby to allow access to have a connection with outside, which can also help rate of asthma in children. Those are the type of things I want to think about versus just prescribing a inhaler to a child.
I love the way that you express that and that you've already come to the conclusion now at this point in your journey. That's actually really impressive.